Structure and function of the renal and urologic systems. The kidney is protected by a tough fibrous layer known as the renal capsule. The central region, or hilum, is where blood vessels, nerves, and the ureter enter or exit. Within the kidney, the cortex and medulla contain essential structures like the renal pyramids and columns. These regions converge into the calyces and renal pelvis, where urine collects before traveling to the ureter. Each kidney consists of 14 to 18 individual lobes, which are the building blocks of renal anatomy. A lobe includes a pyramid and the surrounding cortical tissue, forming a unit for filtration and urine formation. These lobes operate in parallel to process the massive volume of blood filtered each day. Understanding this organization helps us grasp how the kidney manages complex physiological demands. This illustration provides a visual overview of the kidney's internal structures. The image highlights the positioning of the cortex, medulla, pyramids, and collecting systems. Each part has a specialized function, from filtration to urine drainage. Studying these visuals enhances our comprehension of renal function in both health and disease. Solomon's anatomical reference adds another layer of detail to our understanding of the kidney. It reinforces how each structure contributes to filtration, absorption, and excretion. The intricate arrangement of nephrons and blood vessels within each lobe supports high-efficiency waste removal. This design showcases the precision with which the kidney operates. The nephron is the kidney's functional unit, with about 1.2 million nephrons in each kidney. These structures filter blood, reabsorb essential nutrients, and secrete waste products into urine. Cortical nephrons are closer to the surface, while juxtamedullary nephrons extend deep into the medulla. The latter are especially important for concentrating urine and conserving water. The renal corpuscle is the starting point of the nephron and includes the glomerulus and Bowman's capsule. Blood is filtered through the capillaries in the glomerulus, with the filtrate entering Bowman's space. Mesangial cells within the glomerulus provide structural support and regulate blood flow. Together, these components form the foundation of renal filtration. The glomerular filtration membrane consists of three key layers that prevent proteins and cells from entering the urine. These include the inner capillary endothelium, a shared basement membrane, and the outer epithelium containing podocytes. Between podocyte foot processes are filtration slits that allow small molecules to pass through. This filtration process produces the primary urine from blood plasma. The juxtaglomerular apparatus plays a critical role in regulating renal blood flow and systemic blood pressure. Juxtaglomerular cells detect changes in blood volume and release renin, a hormone that initiates the renin-angiotensin-aldosterone system. The macula densa monitors sodium levels and adjusts filtration rates accordingly. This feedback system ensures stable kidney function even under changing physiological conditions. This diagram, adapted from Goldman-Cecil medicine, highlights how the nephron's tubules and surrounding capillaries interact. It shows the close relationship between the filtering units and the vasculature that reabsorbs water and nutrients. The visual emphasizes the nephron's role in fine-tuning blood composition and maintaining fluid balance. Understanding this layout is essential for grasping how kidney disorders affect overall health. Renal tubules include several segments: the proximal tubule, the loop of Henle, and the distal tubule, which all perform distinct tasks. Each segment plays a critical role in reabsorbing water, electrolytes, and nutrients while secreting unwanted substances. The collecting duct receives the final filtrate and adjusts its concentration based on body needs. Specialized cells, principal and intercalated cells, help regulate acid-base balance and water reabsorption. This image, adapted from Patton, Thibodeau, and Damjanov, presents a comprehensive view of the nephron's anatomy. It highlights how the nephron integrates both tubular and vascular components to carry out its complex roles. Understanding this spatial relationship is essential for interpreting kidney function tests and pathology. The image reinforces how microscopic structures have profound systemic effects. The kidney's blood supply begins with the renal arteries, which branch into smaller vessels, such as interlobar and arcuate arteries. Afferent arterioles lead into glomeruli, where filtration occurs, and efferent arterioles exit, forming networks like the peritubular capillaries and vasa recta. These capillary beds are essential for reabsorption and secretion. The renal veins then return the filtered blood to the systemic circulation. This anatomical illustration from Patton and Thibodeau shows the layout of renal vasculature. It demonstrates how each nephron is closely paired with a capillary network that helps regulate filtration and nutrient exchange. These vessels also maintain osmotic gradients necessary for concentrating urine. Any disruption in this vascular supply can significantly impair kidney function. Urine formed in the kidneys travels through the ureters, which are muscular tubes about 30 centimeters long. They propel urine to the bladder using coordinated peristaltic movements. The ureters enter the bladder obliquely, which prevents urine backflow during bladder contraction. This design helps reduce the risk of urinary tract infections. The bladder is a hollow organ composed of smooth muscle layers, known as the detrusor muscle. It is lined with uroepithelium and includes a triangular region called the trigone. Urine exits the bladder through the urethra, controlled by internal and external sphincters. The urethra is shorter in females and significantly longer in males, influencing susceptibility to infections. This visual from Patton and Thibodeau provides a detailed look at the anatomy of the bladder and urethra. It highlights differences in structure between sexes and shows how the urinary system is designed to store and expel urine efficiently. Understanding the bladder's muscle layers and sphincter control is essential in managing incontinence and voiding disorders. The image underscores the complexity of a process we often take for granted. The kidneys receive approximately 1,000 to 1,200 milliliters of blood per minute, an enormous volume relative to their size. Glomerular filtration rate, or GFR, is the rate at which plasma is filtered through the glomeruli. The kidney maintains stable blood flow through autoregulation and tubuloglomerular feedback. These mechanisms protect the kidneys from damage due to fluctuating blood pressure. Renal blood flow is primarily controlled by the sympathetic nervous system. Sympathetic fibers constrict afferent and efferent arterioles, reducing blood flow and filtration when necessary. There is minimal parasympathetic involvement in this process. Hormonal influences include the renin-angiotensin-aldosterone system and natriuretic peptides, which fine-tune fluid balance and vascular tone. The nephron performs multiple essential tasks, starting with plasma filtration and followed by selective reabsorption and secretion. It creates a protein-free filtrate and adjusts it to maintain homeostasis. By controlling water, electrolyte, and pH levels, the nephron helps regulate blood composition. This balance is vital for proper cellular and systemic function. Glomerular filtration is a selective process that allows water and small molecules to pass while retaining proteins and cells. Tubular reabsorption and secretion occur in tandem to fine-tune the filtrate. Net filtration pressure is determined by a balance between glomerular hydrostatic and oncotic pressures. The kidneys filter about 180 liters of plasma daily, resulting in an average output of 120 milliliters per minute. This slide provides a visual representation of glomerular filtration, illustrating how plasma passes through the filtration barrier. The image helps clarify how pressure dynamics and membrane permeability work together to form filtrate. Understanding this process is essential in evaluating renal function. Disruptions in these pressures can lead to impaired filtration and waste accumulation. Tubular transport begins in the proximal tubule, where sodium is actively reabsorbed. The loop of Henle and distal tubule further regulate urine concentration through the countercurrent exchange system. The kidney carefully maintains glomerulotubular balance to match reabsorption to the filtered load. Additionally, the nephron produces uromodulin, a protein that influences tubular immunity and salt handling. Adapted from Wong's textbook on pediatric nursing care, this diagram emphasizes the nephron's regulatory capacity. It visually reinforces how each segment of the tubule contributes to urine formation. These transport processes are highly energy dependent and can be affected by disease or medication. Efficient tubular function is necessary to maintain systemic balance and prevent dehydration or acidosis. The countercurrent exchange system in the loop of Henle helps concentrate urine. Fluid flows in opposite directions through adjacent tubules, creating a gradient that allows water reabsorption. The longer the loop of Henle, the greater the ability to concentrate urine. This mechanism is vital in conditions of limited water availability. Normal urine is clear, yellow, or amber in color. Cloudiness may suggest the presence of bacteria, cells, or high solute concentration. The pH of urine ranges from 4.6 to 8.0, providing a mildly acidic environment that inhibits bacterial growth. Specific gravity, which reflects solute concentration, ranges from 1.001 to 1.035. Several hormones influence kidney function. Antidiuretic hormone, or ADH, promotes water reabsorption in the collecting ducts, reducing urine output. Aldosterone increases sodium reabsorption, also conserving water. Natriuretic peptides and urodolontin counterbalance these effects by promoting sodium and water excretion to lower blood pressure. The kidneys produce essential hormones that affect systemic physiology. Vitamin D, in its active form, is crucial for calcium and phosphate absorption in the gut. Erythropoietin is released when oxygen levels are low and stimulates red blood cell production in the bone marrow. These hormones link kidney function to bone health and oxygen transport. Renal function is evaluated through several key tests that assess the kidney's ability to filter and clear waste. These include measurements of creatinine, blood urea nitrogen, or BUN, and cystatin C. Renal clearance tests estimate glomerular filtration rate and help determine how effectively the kidneys are working. Urinalysis and assessments of renal plasma flow also provide valuable clinical insights. In children, the kidneys are still developing and have a reduced ability to excrete excess water and solutes. Their limited capacity to concentrate urine places them at greater risk for dehydration. The narrow margin for maintaining fluid and electrolyte balance requires careful monitoring. Additionally, immature kidneys increase the risk of drug toxicity due to slower clearance. As people age, renal blood flow and glomerular filtration rate decline. The number of functioning nephrons decreases due to vascular and perfusion changes. Older adults also experience reduced responsiveness to acid-base imbalances and altered thirst mechanisms. These changes contribute to an increased risk of fluid overload, dehydration, and adverse reactions to medications.